Thank you, everyone, for joining our London Health Sciences Centre community update meeting. It's our first meeting of 2025. And before we begin, I'd like to turn things over to Jerry Plastino, who's our Vice President of Clinical Diagnostics, Pharmacy, and Biomedical Engineering, for a land acknowledgement. Jerry?
Thank you, David, and good afternoon. Today, I share that I'm speaking from LHSC, where Victoria University and Children's Hospital stand on the traditional territories of the Anishinaabe, Haudenosaunee, Lunapoak, and Chongtung nations on lands connected with the London Township and Songbird Treaties of 1796 and the Dish with the Once Boom Covenant Wampum. We are neighbors to three First Nation communities: Chippewas of the Thames First Nation, Oneida Nation of the Thames, and the Delaware-Munsee Nation. I'd also like to take this opportunity to acknowledge the lands of Sault Ste. Marie, where I was born and raised. The city's name came from French settlers, but was traditionally known as Bawadi, which means the place of the rapids. As a settler, I recognize the importance of my relationship with these lands and how they've contributed to my life. These lands continue to be home to diverse Indigenous peoples, First Nations, Métis, and Inuit, whom we recognize as contemporary stewards of the land and are vital contributors to our society. I remain committed to learning Indigenous history and culture, and I will continue to seek actions that contribute to improving the health and well-being of Indigenous people. This includes leveraging my role as a healthcare executive to drive to action meaningful changes, enhanced engagement, and improved awareness that drives safer access and healthcare opportunity. Thank you.
Thank you, Jerry. So for those of you tuning in for the first time, welcome. This is our fourth community update meeting. So just a little refresher, these sessions serve as a platform to keep you in our community informed about what's happening within LHSC and to share updates on new initiatives and outline the steps we're taking to deliver on our promise of excellent care. So these meetings are being live streamed through our website and social media channels, and a recording is also available afterwards. As stated previously, as we move forwards and towards renewing of the LHSC Board of Directors in the fall of 2025, we will be making these sessions to be the format for any LHSC virtual board meetings to be shared with the public. Starting this month, our meetings will also be replayed on Rogers TV London. Whether you're joining us live or catching up later, we're making every effort to reach as many people as possible with these meetings, including now through Rogers TV, as always. We're here to listen and respond to your questions, and you can reach out at any time by emailing me directly at the Office of the Supervisor. It's all one word, Office of the Supervisor at lhsc.on.ca, or give me a call at 519-870-2999. Again, 519-870-2999. Just want to highlight a few things. Our CAC survey results. I want to start today's meeting off by acknowledging the outstanding contributions of our Community Advisory Committee. This is a dedicated group of volunteers who recently already held their third meeting since I've been appointed supervisor, and we continue to make meaningful progress and gathering valuable input that's going to shape the plans for the future. Their commitment to listening and learning from both Team LHSC and our broader community has been inspiring. So the group met last week and we discussed response rates from our community and staff surveys. The surveys closed as of January 8th, and we received an impressive 4,064 responses. So I want to thank everyone who provided your input to the CAC. Now what's happening next is we're analyzing the results. We'll be preparing reports to highlight the findings, and once finalized, these reports are going to be shared with CAC and also the executive leadership to inform our plans and decision making. Also, most importantly, is they will be shared with all our staff and physicians and you, the community, as well for your review. So the CAC looks forward to sharing what they learned from the results. So please stay tuned as they do this very important work. Also, I want to highlight the surgical center expansion. That was a great, exciting announcement we had at LHSC last week. We were joined by the Honorable Sylvia Jones, who's our Deputy Premier and Minister of Health, and also Honorable Rob Flack, who's our Minister of Agriculture, Food and Agribusiness, and the MPP for London, Elgin, Middlesex. And they announced the funding to expand LHSC's Nazem Kadri Surgical Center. So for those of you not familiar, that center was opened in 2020, and it's the first high efficiency ambulatory surgical center in the province. It's attracted already national and even global attention for its innovative model that allows us to perform lower risk or lower complexity surgeries, for example, like hernia repairs or orthopedic procedures, in a faster, a lower cost, and with consistently high patient satisfaction results. So this expansion, which includes 4 new operating rooms, is going to triple our surgical capacity in the surgical center, allowing us to perform approximately 6,000 surgeries annually. So this not only allows us to perform those less acute surgeries in the surgical center, but it frees up capacity in our main OR, where we can perform even more complex surgeries, which service pretty much all of Ontario. So it's a win-win for everybody, and this will increase to help reduce wait times and improve patient access overall. So this expansion is a great testament to the work being done by our team, and I also want to extend clearly my gratitude to the Government of Ontario and to the Ford government for this investment in our patients. Last thing I want to talk about is our Great Moments program. If you're not aware of this, this is where individuals from the community and fellow staff members can recognize the great moments that are happening within the walls of LHSC. It was introduced again to recognize this work, and it allows a platform for this work to be identified. Each moment is shared with our individual staff member along with their colleagues, and it's a great celebration of the recognition of the work that they're doing, not only individually, but collectively. We started this in November only, and already we have close to 700 individuals being recognized by colleagues and people from the community. It's really taken off. So not only are they given individual recognitions, they get to wear a little lapel pin and celebrate not only their personal achievement, but also celebrate with fellow staff members. So it's a great opportunity. And as the name goes, it's a great moment. So if you want to recognize a team member, use the QR code that's on the screen in doing so. Now, I have the privilege of introducing our next presenters, who are senior administrative and physician leaders of LHSC. A lot of times you don't get an opportunity to see these individuals. You maybe know them by name, but now you have an opportunity to hear about the great work they're doing here at LHSC in enhancing patient care. So I'm going to hand it over to Deborah Wiseman, who's our corporate nursing executive, and Dr. David Stephen, who's our department head, clinical neurological science, and interim chair of our medical advisory committee, to start things off. Deborah and David, it's yours.
Thank you, David. So I'm Deborah Wiseman. I am the corporate nurse executive. What that means is through the Public Health Act, all corporations that are hospitals in that act have a senior nurse. It is one of my most favorite components of my role. And I thought it would be prudent for us to review the most recent College of Nurses report. These reports on statistics of our nurses in Ontario come out every 5 years. And so we see this year a record high nurses renewing their registration. So over 183,700 nurses renewed their registration. That's a gain of almost 5,600 nurses in the 5 years since we've last looked at these statistical results. The registered nurse, which is a classification within the realm that many of you are familiar with, do continue to increase, but the biggest increase we saw is what's called a dual registration. Those are registered practical nurses who register both as a registered practical nurse, but also as a registered nurse. We see many RPN staff members transitioning to the other classification of registered nurse, and certainly see that in the statistics this time around. Additionally, we are seeing some increase in movement of nurses outside of Ontario, although the percentage remains very small. And as with all things, our newest graduates make up those new registrations. And then we have our internationally educated nurses, which continue to drive the total growth of nurses in Ontario. It might be interesting to you that at LHSC in 2019, our registered nurse, our RN total was 3,282. And then as we came into 2024, in December of 2024, we sit at 3,787. So a significant increase of our registered nurses, even inside LHSC. Our longest serving registered nurse is at 45 years. So big shout out to her or he or they. Our RPN registrants in 2019 were 486. That has gone up to 742, and our longest serving RPN is at 37 years. So a significant commitment of our nurses today. I'm going to share the screen now with Dr. David Stephen, who's going to update us on illnesses and a Canada First. Thank you.
Thank you, Deborah. And I'm David Stephen, and I'm the head of Clinical Neurological Sciences, which is the neurosurgery and neurology. And I'm also the interim chair of the Medical Advisory Committee. And it's in that role that I'm speaking today. And the Medical Advisory Committee is the committee at the hospital that is responsible for the quality of medical care at London Health Sciences Centre. And I wanted to bring to your attention some of the illnesses that we're seeing in the community that is impacting the community and impacting the hospital. This is the thick of the respiratory season, as we all know, and COVID-19, influenza, and RSV cases are all on the rise, and that's impacting the emergency department and the hospital. The symptoms are overlapped between all these conditions, and without testing, you would not know which of them you have necessarily, and they include fever, cough, fatigue, sore throat, runny nose, and they can be, again, like I said, very similar and would require testing to know which one you have. There are a couple other viruses circulating that are also on the rise over the last few weeks in Ontario. One of them would be norovirus, which is a stomach flu. It's a virus that attacks the stomach, and it causes typical gastroenteritis, so nausea, diarrhea, cramping, vomiting, chills, etc. Patients can be quite ill with that condition. And secondly, measles is on the rise in the community. So be careful about measles. Again, it has fever, cough, and runny nose, which can overlap with the respiratory conditions I mentioned earlier. And also, of course, it can have a skin rash with red blotchy patches that appear on the face and arms, after a few days after what looked like a respiratory illness. So just wanted to bring to your attention those viral infections that are affecting the community at the moment. Next slide, please. And one story that we wanted to share was a Canadian first in cancer treatment at LHSC. So prostate cancer is the most common cancer in men in Canada and affects 1 in 9 men in their lifetime. And Pluvicto is a targeted radioligand therapy that uses a radioactive drug to kill specific cancer cells. So it's targeted at the prostate cancer, and it's produced in Ontario. And Ontario is actually the first Canadian jurisdiction to administer a publicly funded dose of Pluvicto, and that occurred at London Health Sciences Centre on December 25th, 2024. So that's a great Canadian first for LHSC and for patients with prostate cancer. And then I'm going to pass this on to Dr. Adam Ducalo, who's the Integrated Vice President of Medical and Academic Affairs.
Thanks so much, Dr. Stephen and Deborah. I have the privilege, as David mentioned, of being the Integrated Vice President, Medical Affairs, as well as the privilege of being an emergency physician at London Health Sciences Centre in St. Joe's here in London as well. Just going to speak a little bit about medical affairs and the role that medical leadership plays in our hospital system. The majority of time you come to LHSC, you'll be seeing one of the 1,400 doctors, dentists, or midwives that work on our walls. Unlike the rest of the team here at LHSC, most of these providers are not employees in the traditional sense. Ontario healthcare system is set up such that doctors in hospitals have privileges instead of being employed like other people who work in hospitals like nurses. Julia Markison will speak about the employment relationship later in this presentation. When you come to LHC, there's also a good chance you'll see someone who is training to be a doctor or a dentist or a midwife, such as a medical student, or someone who's a doctor because they've already graduated from medical school, but is not able to practice on their own. This group is referred to as residents, or many of you may know them as interns. 10, 20, or 30 years ago, you could finish medical school, do a one-year internship, and then be a full-fledged practicing physician. You can't do this anymore, but commonly residents still get referred to as interns. Residents are at a stage of training where they're working in their chosen field, such as family medicine or surgery, or to become a neurosurgeon like Dr. Stephen, but they aren't quite there yet. All of these resident dentists, doctors, midwives, and learners require support in the background to be able to care for you. If we can flip to the next slide, please, that'd be great. That support is provided by a lot of different groups of people. Obviously, Western is involved when it comes to medical students, as well as here at the hospital, medical affairs. Medical affairs is key to ensuring when you come to our hospital, the doctor you see has the training, license, certification, knowledge, and skills to provide the care you expect of us. Since around 2006, medical affairs in London was a shared department between St. Joseph's Healthcare and LHSC. That made sense because doctors, dentists, residents, and medical students move between both of our hospitals, just like patients do. Over the last couple of years, there was some consideration and work to split up medical affairs between the two hospitals and provide it as a hospital-specific service. In December, David Mouget and Roy Butler announced that I would become an integrated vice president and work to reintegrate our medical affairs team. We are hard at work making that happen to ensure that the doctors that serve you do a great job in concert with people like David Stephen and our medical advisory committee. Medical affairs performs human resource functioning, like planning on how many doctors we need and how we're going to hire them and recruit them to our city. We also monitor their practice, deal with your concerns or complaints. The funner part is when we deal with your compliments, like through the program that David Mouget mentioned earlier. We administer dollars from the Ministry of Health for things like being on call. As mentioned a few minutes ago, residents are people that have graduated medical school but still need more training in order to treat patients on their own. We are lucky in the City of London to train residents in all areas of medicine, from family medicine to very specific areas like cardiac or heart surgery or urologic surgery. We also need to confirm their degrees in training prior to allowing them to work in the hospital. In terms of medical students, we're lucky to have a fantastic medical school in our city. And medical students need to take all the stuff they learn in the first couple of years sitting in front of their computers or in front of a lecturer and learn how to apply it in the last couple of years of medical school during their clerkship and elective rotations. If you're interested in learning anything more about medical affairs or medical leadership in London, please don't hesitate to reach out to me. Before I pass it on, I want to take a few seconds just to thank our doctors, dentists, midwives, residents, and medical students for the work they do every day and frankly every night to care for our patients and our community. I now have the pleasure of passing it over to Julia Markison, our Vice President of People and Employee Experience. Thanks, everyone.
Good afternoon, everybody. We wanted to take this opportunity in this session of talking to the community to talk and focus from an HR perspective on labor relations. We are a very big employer, and although it tends to be that we talk a lot about doctors and nurses, it takes literally hundreds of different roles to make a hospital work. And so in talking about the various unions that represent those workers, we'll get a chance to talk about all of the different roles as well in the next few minutes. Hopefully everybody's aware of the fact that hospitals are considered essential services. So people who work in hospitals can't go on strike, and hospitals can't lock out those workers. When we can't reach resolution through negotiation, we have binding interest arbitration. And often that's the route we take to resolve negotiations. We're also involved with the Ontario Hospital Association as they lead provincial bargaining with some of our biggest unions. And I'll talk a little bit more about that in the coming slides. And so we lead local negotiations with some of our unions, and we participate in central collective agreement negotiations with the Ontario Hospital Association for some as well. It's a complex world for sure, with many different collective agreements and unions involved. We're going to go to the next slide. The 2/3 of the workforce at LHSC are represented by a union or a professional association, so that's about 8,300 people. And most of those unions have been representing those groups for decades. By history, Victoria Hospital was certainly unionized earlier. I mean, University Hospital is newer, having only opened in the 70s. But both hospitals, including Children's Hospital, are all highly unionized. We've had significant success working with our union partners in reaching negotiated settlements outside of arbitration. Sometimes we do need to go to arbitration, but we are always working to reach settlement without arbitration. And we watch closely our grievance and arbitration trends because we see the declining trend as an indicator that we are working well with our union partners. So we continue to see that as a really important goal. Next slide, please. So the Ontario Nurses Association is our biggest union, not a surprise there, I wouldn't imagine. As Deb has already talked about, there are about 3,800 members at LHSC, and the Ontario Nurses Association has both. We have a local contract and a central contract. And right now, the Ontario Hospital Association is negotiating with the Ontario Nurses Association at the central level, and we're just getting ready to negotiate with our local as well. The Ontario Nurses Association also represents, in a separate bargaining unit, radiation therapists and dosimetrists. These individuals work at the Verspeten Family Cancer Centre, and as you can imagine, delivering radiation therapy requires some very specific skill and knowledge. And we were very lucky to have this group of workers and professionals in our organization, and they're represented separately, and we negotiate their contract locally. Next slide, please. Unifor is the second largest union at LHSC, and Unifor represents about 2,100 members. And a whole wide variety of different roles. So registered practical nurses, personal support workers, aides, porters, child and youth counselors, emergency department technicians, all of the people who work in our dietary areas, our stores keepers, our receivers, our linen workers, and a whole host of trades plumbers and electricians who keep our physical plant working. We also have our pharmacy technicians and occupational and physical therapy assistants who are represented by this union. This contract is negotiated locally, and we will be working on that negotiation over the coming year as well. We can go to the next slide, please. Our next group is OPSU, that's the Ontario Public Services Employees Union. And this group represents many of our technologists. So we've got audiologists, dental assistants, respiratory therapists is probably one of the biggest groups in this group, pathology assistants, anesthesia assistants. So anesthesia assistants tend to be respiratory therapists who've got additional training and work in the operating rooms. Perfusionists often tend to be as well respiratory therapists who have special training in how to run heart-lung bypass machines, and they too run and work in the OR and in our critical care areas. And a host of other groups like cardiac, ultrasound, ultrasonographers, those kind of people. This is a smaller bargaining unit, about 1,000 members. That is still a good size, I suppose, but smaller compared to the previous two groups. And we've got a second smaller bargaining unit that represents pharmacy technicians, occupational therapists, and physiotherapists. And if you, that group is represented by a different union at a different site. So it contributes to the complexity of the system at LHSC for sure. We can go to the next slide. The Canadian Office and Professional Employees Union is our very small group. It's about 450 members. And this is all of our administrative professionals. So clerks, receptionists, secretaries, switchboard operators. This is a locally negotiated contract. And we are in process with working with this union as we speak. We can go to the next slide. The Professional Institute of the Public Service of Canada represents a small group of very highly specialized professionals. So they represent 18 medical physicists who work in the Verspeten Family Cancer Center. And these are people who actually attend to the safety of radiation devices and do a lot of the major calculation and therapeutic. They work with oncologists on the therapeutic administration of radiation. So this is a group of people who we negotiate at the provincial level, and the Ontario Hospital Association does that on our behalf. But again, a very important group of people when it comes to providing cancer care in London. We can go to the next slide. And then the last group we want to talk about is that the residents that Dr. Duclos talked about in his presentation. So these are people who have graduated from medical school but are still in training to become independent physicians. So the Professional Association of Residents of Ontario represents that group, and there's about 782 of them here at LHSC, and that contract is also negotiated by the Ontario Hospital Association on our behalf. And again, that's a group that the hospital would not function without this very important group of professionals at LHSC. So as you can see, this is a lot of different groups who are represented by local and centrally negotiated contracts. And we very much value the relationship we have with all of these associations. And the care delivered by all of these professionals is absolutely essential to the healthy running of a hospital. Next slide. I am going to happily hand this over to Deborah Wiseman and Dr. Kelly Voigt, who are going to talk about our very impressive trauma program.
Thank you. I'm so grateful to Julie and her team for the work on that complex HR responsibility, and to those teams who support the care of our patients. We'd like to shift gears and speak to you about a fabulous trauma program that we run here at LHSC. I'd like to introduce Dr. Kelly Voigt, and we'll go to the next slide. We are one of 5 trauma centers in Ontario, and we are a lead trauma center. And so what does that mean? What it means is that we provide care beyond what extends from an emergency treatment opportunity. We integrate our services and take a holistic approach that provides a consistent approach to patient care that offers what we believe to be better outcomes. The map, you can see the map on the right of the screen here, identifies that we work in a system of trauma care, and often with our regional partners, not just the hospitals in our region. We also work with our EMS partners and our Orange partners who help support with the transport of injured individuals. Trauma care really supports patients who have an injury that extends to more than one body part. And the totality of our regional area covers about 1.6 million people, and we engage potentially with about 30 other hospitals. 50% of those injured are local and come from our London city, and 50% are transferred from one of these other locations. We see about 900 adult patients per year and about 200 pediatrics. Next slide. So as I mentioned, care often starts outside of London Health Sciences Centre, and we do rely heavily on teams that have advanced training in stabilization of patients before their arrival to London Health Sciences Centre. Both in the pediatric and or in the adult world, what you'll experience should you or a family member require this trauma service is that we come as a team to support your needs. We have a trauma team leader who coordinates the care and the efforts that are occurring. But in addition to that, as I said, we're an integrated service. So there might be surgeons from other specialties. You'll likely see some of our emergency room team, doctors and nurses, respiratory therapists, our lab services, our blood bank, our diagnostic services could be in for imaging or other procedural requirements in those areas. And while you're here for hospital care, should you stay for hospital care if necessary, you'll be seen by a trauma physician as well as learners. You'll be supported by a dedicated nurse practitioner. Additionally, you might still have that integrated service with surgeons. We might have our critical care engaged and involved, other specialty services. You'll be supported by a team of health disciplines that includes our social workers, our physiotherapists, occupational therapists, speech language, pathology if you need it, as well as pharmacy team members. An entire team that is dedicated to supporting your needs as you traverse this journey in a trauma situation. Dr. Voigt?
Thank you. I'll have you flip to the next slide. In the trauma world, we believe strongly that there are no such thing as accidents. Whether at the level of the infrastructure and legislation that exists provincially or nationally, all the way down to a personal level, we think that all injury is preventable. It is a core mission of the trauma program at LHSC to prevent injuries. It's not always possible, however, so where injury is not prevented, we play a key role as the regional trauma center in treating patients with these injuries. And you saw details of who would help us do that on the last slide. Multi-system injury needs multi-system treatment, and our team has a specific expertise in the whole person approach to care. While we do place particular emphasis on the first hour and a half after arrival as the time where we have the most opportunity to respond to a patient's injuries and give them the best chance of survival, we know that the rest of their hospital stay and beyond gives us an opportunity to do our best to have them leave our hospital to go on to live their best life. This often includes extensive rehabilitation for both their physical and psychological injuries, and sometimes this is in a specialized rehabilitation facility. We also know that the journey doesn't end when you leave our hospital. In our trauma follow-up clinic, where we discuss the physical recovery from injury, as well as the mental and financial challenges that can come with this, plays a key role in patient recovery. And I will highlight that this clinic makes us unique amongst other hospitals. We were the first to have this type of clinic in Canada, and only a few other trauma centers across the country have a similar clinic even today. Have you flip to the next slide? And this has been alluded to, but as the trauma center for our entire region, we really do have significant responsibilities that lie outside the walls of LHSC. We're the hub in a hub and spoke model for all other hospitals in our region who don't have a trauma program. And we regularly provide education on how best to stabilize patients who arrive on their doorsteps after injury before they're able to send them down the highway or through the air to us. And also on how best to care for them when they return to hospitals closer to home in the rehabilitation and convalescent phase of their care. As Deborah mentioned, we have to work very closely with our partners in pre-hospital care and transport, including both Orange Air Ambulance and the local EMS groups. And recognizing that trauma doesn't always respect regional boundaries, we sit at provincial tables with the Ontario Trauma Advisory Committee, Critical Care Services Ontario, and Ontario Health. And on my last slide, I wanted to share something that our team is extremely proud of, and that speaks to the ongoing care after physical injury recovery is well underway. Our annual survivor reunion is a highlight in our program's calendar. Co-led by our nurse practitioner and organized by our trauma program manager, social worker, and members of our health disciplines team, this event brings together survivors of trauma and their loved ones with the teams that cared for them throughout their journey at LHSC to provide support and to remind them that they're not alone. It also is a great opportunity to remind our team at LHSC how much of a difference we can make when we work together. And with that, I'll conclude by thanking all of the people who help us care for injured patients in our region, and hand things back over to David for his concluding remarks.
Thank you very much for the whole team on the presentations today. That was quite a lot of ground we covered in a very short period of time. And thank you everybody for participating today. So before we close, sorry, I want to remind everyone that we have a web form available for you to submit questions to be answered in these meetings. You can find the link in the description on the YouTube page and on the community update meetings page of our website. We also have a QR code up on the screen right now for you to scan. It's going to take you to a form to submit questions you might have. Now, since our last meeting, usually at this time, I respond to questions we got at our last meeting, but didn't get any. So even though there are hundreds of individuals who watched the video, that's great. And it doesn't mean that there weren't questions, but maybe you were a little nervous in sending the questions. Please don't hesitate. If you have a question about what we talked about or any other issue for that matter, send it our way. And we'll try to help you at a minimum, navigate you to the correct individual to get an answer to your question. We know healthcare can seem very complex, and actually it is, but also it's a very difficult area to navigate for patients, and we try to do our best in trying to minimize the stresses that come along with healthcare. But unfortunately, generally, if you're coming to the hospital, it's generally a stressful situation for either yourself or a family member. And we try to reduce that stress as much as we can. So if you do have questions, don't hesitate to ask them. And again, we'll try to get those answers to you. So, and also we'll make sure maybe it'll allow us to focus on something in the future presentations on things that you're asking about, and it'll drive us to focus on those in future presentations. So I really want to thank everybody for tuning in. And I hope you find these meetings very helpful and valuable for you. To our media partners, please join us for our media scrum at 1 o'clock. And we look forward to addressing any questions our media partners might have. So again, I hope everyone has a great day and to a great 2025. And I usually would say go Lions, but we'll have to wait till the fall for that to happen again. So take care, everybody. Go Tigers. Thanks.